African Americans make up 15%, almost 15% of the population, but only 4% are, doctors.
And according to a new study, this may be a contributing factor in the higher death rate of black men compared to other populations. 66%,
by the age of 50 are at risk for having high blood pressure compared to the general population, about 33%. And, across the board, diabetes, heart disease, cancer, and that applies. And these are all preventative diseases.
The study published by the National Bureau for Economic Research involved more than 700 black men in California who went to a clinic for free health screenings. The men were randomly assigned to a black, a white, or an Asian male doctor. The result? When asked to go for follow-up screenings, such as a cholesterol test, 62% of black men with a black doctor agreed, compared to 36% assigned to a doctor who was not black. Similar results were found with additional screenings for diabetes.
The basic doctor-patient relationship is built on trust, so there's a rapport that's involved with that. So patients feel comfortable with their doctor, they're more likely to engage in preventive services.
Nobody wants to be, how can I put it, told that they have some disease.
Experts agree genetics, environment, and responses to medications may all share the blame in stacking the deck against black males. Still, you can reduce your risk factors.
You can change smoking. You can lose weight so that your blood pressure goes down, so that your cholesterol improves. So a lot of these things are modifiable.
Which is why DeVry Pazant, president of the fraternity Omega Psi Phi, recently partnered with Holy Name Medical Center in Teaneck to hold a health seminar where men like John Herbert could learn not only more about their risk factors, but what to do about them from healthcare providers who look like them.
I thought today's event was terrific. I think it is so important to get public health messages out to the community. I think it is important that we see the role that we can do to improve our own health.
Medical schools have been working to admit more minority students, both men and women, and hospitals are recognizing the need for culturally sensitive care. Eventually, patients will be more likely to see doctors who look like them and sound like them, and they feel they can trust. That should go a long way in reducing disparities in health care. Dr. Max Gomez, CBS 2 News.